talking to Susan O'Brien. She is the Director of Communications for the Comptroller of Maryland, Peter Franchot. Susan, you posted on Facebook a little earlier, and I called you about this and wanted to know a little bit more. I'm glad you're feeling well. However, you did test positive for coronavirus, yes?
According to the test I took last Tuesday, yes.
How many tests have you had done since?
Since that first positive last Tuesday, I've had 2 more PCR tests and another rapid test.
So 3 altogether?
But they do the PCR and the rapid together at first call.
Okay. When you tested positive, that was the test done at the state's testing site, which is right near your office in Annapolis, yes?
That's right. Pretty much since they started testing. Since the pandemic started, I still go into the office. Since we went back to partial staffing in the offices, probably in June, I go in and my entire staff telecommutes. So I go into the office. There's a skeletal crew of people who come into the office. Most people are working from home. So I get tested. I was getting tested about every other Tuesday. So there was a pop-up University of Maryland Medical Systems pop-up testing site next to the State House, next to our building, that we would go to on Tuesday mornings and get tested. So I have been consistently going there all summer. And I tested on November 10th, and I was negative. And that's a PCR test. They had not been ever doing rapid tests. I had actually never had a rapid test.
Okay.
And then on November 17th, there was a new system put in place. They're now daily testing at this site. I'm sure it's in preparation of the Maryland General Assembly's legislative session in January. But they're testing at this site. And in addition to testing the normal PCR test, which goes out to lab, they do the rapid test as well. And this is being administered by Cyan Diagnostics. Last Tuesday, November 10th, there were a bunch of us that went over to be tested just like we always do. Everybody got their rapids. Everybody was negative, including me. I had a negative rapid test on Tuesday. So Wednesday, a few of us came into the office because it was Board of Public Works Wednesday. That was the 18th. And the comptroller came in. He hardly ever comes into the office. He's been mostly working by Zoom and Teams and virtually. So he comes in to do the Board of Public Works. So there were a few of us in the office on Wednesday with him doing Board of Public Works. And then we did a few videos. And I went back up to my office and got a call that my PCR test from Tuesday was positive. So, of course, protocol is I immediately leave the building, which I did. And I came home. And a whole bunch of people got their test results back that day, too, and they were all negative. So I came home, and I asked my children and their dad to go get tested just in case, because I had been near my kids. And so Thursday, everybody got tested. All my friends, my family, people I had gone walking with, a couple people in the office who I had interacted with got tested on Thursday. Including our videographer who came in on Wednesday. Everybody got tested on Thursday. I actually also got retested at the county site across from Arundel Mills. And then I also decided to go to a site that I knew was not using Cyan Diagnostics or the Korean test kits. And I went to First Call Urgent Care in Gambrills and got rapid tested and PCR tested.
The results were what?
Negative.
Both the tests you had done on Thursday were negative?
No, the county test I haven't gotten back yet.
Okay, so the test that the non-Korean test that you had done was negative.
Correct.
Let's go back, though. So you had the test on Tuesday. You were with the comptroller in his office. He was unmasked.
Correct.
We see that in at least one of the videos that was posted on social media. Yeah. You were masked. You were how close to him?
Probably 10 feet.
Okay, and on Monday, right before that, you were in his house too, right?
And we were all masked.
Including the comptroller.
We wear our masks all the time, yep.
So has the comptroller, because the comptroller has been still in close proximity to you in an enclosed space, has he had a test done since?
No, and he has been home and he's isolating at home.
Is he going to have a test done?
He feels great. I don't know. He's feeling good. He has no plans to travel or go anywhere or doesn't have any face-to-face meetings coming up. He'll probably just quarantine like the recommendations are to quarantine if you've been exposed. Again, there's some people who think that it might have been a misread of my test. I'm just assuming I was positive. So I'm quarantining at home. I'm isolating, and I will until December 2nd.
And you are asymptomatic. You have absolutely no symptoms.
Right. I have no symptoms whatsoever. I don't even have a fever. I can smell and taste. I just made amazing turkey chili.
That's great.
Yeah, and my family's tests all came back negative. I actually took my son to be retested because he has actually sort of like the symptoms of like strep. So he's been retested. He is negative.
It sounds like you initially, with the post that you put on your own social media, you were a little leery of the results that came back. I know you're treating it like you are positive, but you're leery
I am treating it as I am positive because they are typically very, very accurate. These PCR tests are typically very accurate. The rapid ones, not so much, especially on asymptomatic people like me. So I wanted to be rest assured because if it had just been a normal test, like someone went to go get a test and they got a result. But when you're surrounded, and we contact traced everything I did, every step I took for the week between my negative and my positive, nobody in my orbit has tested positive.
Are you leery of the Korean test kits?
I'm a little bit leery, yeah, but I can't even entertain that thought. I've got to assume I was positive.
I had also told you on our initial conversation, which was before this call, about the president's tweet earlier today. The president shared a Breitbart article about the questions on the South Korean test kits and Governor Hogan's purchase of these kits. Do you have any thoughts on that?
I have zero thoughts on anything in Breitbart. I do have thoughts on Governor Hogan. I think he has done an earnest job of doing as much as he possibly could do on his own without any type of federal or national leadership. I commend Yumi and Ms. Hogan, First Lady Hogan, and the governor for doing anything they could to get their hands on test kits to help, get some sort of an understanding of where Maryland was in this whole scheme of things. I have no problem with the fact that we have test kits from South Korea. I know that there's human errors. I know that there's lab reading errors. I know that there is a massive rush of tests being processed right now because people still are, hell-bent on traveling for the holiday. I just know that mistakes happen. I'm not saying that it's 100% the manufacturer of the test. I'm not saying it was the lab. I'm not saying it was the humans that administered it or read it. I would rather a governor, like Governor Hogan, go above and beyond our borders of our country to help make sure our citizens are safe. And here's the thing. I isolated immediately. I'm asymptomatic. This is why I keep getting tested. People ask me, why do you get tested if you don't have any symptoms? Because I could be asymptomatic. There is no doubt in my mind right now, and this is how I have to believe, that I was positive at some point. That means I didn't go to the dentist as I was scheduled. I'm not getting my hair done as I was scheduled. I'm home and I'm isolating and I'm wearing a mask and I'm doing everything that I can to protect myself. And then going forward, I can't even pretend like I was positive because if there is a small chance I wasn't positive, I can still catch it in the future, whereas some people become immune after they are testing positive.
Okay, with all that said,
continue the course.
With all that said, do you think the comptroller should get a test?
I think if he starts to feel bad, he should get a test. If I start to feel bad, I should get it. I should tell him. I should tell anybody if my symptoms change. I was told that most often when you test negative on a rapid and positive on a PCR, that means that you probably had COVID and you're on the tail end of recovering from it, and the rapid tests are not sensitive enough to pick up the waning vital cells.
And Susan, was that a medical professional that told you that?
Correct.
So even though you were in close proximity to the comptroller, you don't think that he should get a test if he's starting to feel symptoms?
I think he's isolating at home. I think he feels fine. I think he's healthy. I think these lines I waited in my car for 4 hours to be tested. As long as he's feeling fine, as long as he's feeling healthy, I think he'll take the right steps that he needs to take to protect himself and his family if necessary. And he's been tested before. I've actually been with him when he tested. So he has no problem being tested if it's needed. Okay.
You continue to stay well and keep us advised. I'm sure we will know how you're doing. We know you on Facebook. Yeah. We know you through the phone. we talk to you a lot.
Yeah, and we all believe in transparency, and I've lived my whole life as a public relations person that wholeheartedly believes in transparency, and we'll continue to do that.